Our feature headline would be, Eidos work reduces risk of suicide attempts and suicide death among emerging adults who identify as LGBTQ+.
If I saw someone, using my product in real life, as part of their daily life, I think that is success to me.
The elimination of tobacco-related behaviors in LGBTQ populations.
I would love for us to be able to say that young queer kids aren't homeless anymore.
Eidos is transforming LGBTQ+ health, and we will change lingering health disparities by getting solutions to those in need.
I think we're pretty good at identifying what has gotten us sick. I think it's time for us to think about how are we going to solve that.
Connecting innovation to innovators, then idea to ideation to prototype. Translating, testing, and transforming.
How we use our discoveries that we have through research and make sure that this evidence-based practice is accessible to communities in practice, and that is the LGBTQIA population.
Eidos will create scalable, sustainable products that will transform the health of the LGBTQ+ community.
That involves more partners than what you find in a university setting. It means communities, it means end users, it means looking at business models to help sustain the work that we've done here.
How do we bring in university partners, community partners, the government sector, philanthropy, and the business sector together to really think about solutions that aren't just the responsibility of one group of people, but all of us.
Eidos will bring products to market that will improve lives.
We absolutely need to be working in partnership with the other 12 schools here at Penn.
There's a space for all the 12 schools at Penn to contribute to Eidos. I could see bringing in the strategy and the leadership from Wharton, the social justice components from nursing and the School of Social Policy and Practice, the policy arena, both in education, but also how we educate people from GSC, the need to understand the legal protections from the law school, and then how do we integrate that across all of our health sciences schools. So it's a big tent.
I do this work because my friends have died. They have died from suicide, they have died from cancer, they have died from HIV, they have died from heart disease, way too young, way too beautiful.
What brought me to do this work is really the lack of care and resources for this field back where I come from.
The LGBTQ+ community has traditionally experienced minoritization and stigmatization.
There are a lot of people who struggle with trauma and PTSD symptoms who never have that opportunity to think about someone caring enough about them that they can build a life that matters.
The system is failing us, and it failed all of my friends that I've lost. And so I don't have a choice but to wake up every day and make sure no one else suffers another day.
We're so focused on the deficit so often in public health that we forget that there's resilience, there's empowerment, and there are resources both intrinsic to ourselves and in our communities that we can leverage to solve some of these wicked problems.
I want innovative, transformative social services. I want things we've never even thought of to happen. I want to fund and find projects that no philanthropist would touch, that no government would touch. I want us to build bigger, and I want it all to happen right here in Philadelphia.